gastroesophageal reflux. It's not normal for the stomach acid to reflux. This isn't normal. It is problematic when stomach acid flows the wrong way, causing irritation because the esophagus isn't accustomed to receiving acid. What do you feel? Well, a burning sensation like chest pain. There may be difficulty swallowing, feeling of a lump in the throat, what is colloquially known as heartburn. Especially in the morning, your mouth might feel strange or somewhat uncomfortable. Sometimes it can even affect the vocal cords and you might find it a bit hard to talk. This fades away as the day goes on, but this is far from being normal. We need to ensure that gastroesophageal reflux isn't occurring. Gastroesophageal reflux and stomach cancer are commonly linked with smoking, obesity, and diets you consume. If you eat a lot of salty or irritating foods with not enough vegetables and fruits, and on top of that, you have a family history of gastrointestinal infections, or you've had a bacterial infection like Helicobacter pylori, it can cause inflammation and potentially anemia. The irritation can be so severe that it leads to a rupture of the stomach wall, resulting in gastritis with a perforated ulcer. This brings us to the topic of peptic ulcers. Peptic ulcers develop in the stomach, where they're called gastric ulcers, and can also form in the duodenum, the first portion of the intestine, where they're referred to as duodenal ulcers. These resemble scars or sores that can form in the stomach or duodenum. If left untreated, they can open up and bleed, such that you don't notice until your stool takes on a blackish color from digested blood. This indicates that you have upper gastrointestinal bleeding. The most common cause of a peptic ulcer is an infection by a bacteria named Helicobacter pylori. Although it's not the only cause, it's one of the most common as it increases acidity in the stomach. Actually, aloe vera is beneficial for stomach health. It is positive for digestion, and if you've noticed any acidity, indigestion, or gastric issues, taking aloe vera can regulate acidity. It also aids the movements of the colon to prevent constipation and has beneficial effects on other systems we have spoken about and will discuss in the future. Remember that digestion starts in the mouth, continues in the stomach, and then into the intestine. There are enzymes released by the pancreas, and the stomach also has some for protein digestion. However, some people, for various reasons, do not release the required quantity of enzymes for the digestion of certain foods or food groups. This then makes digestion heavier, more complicated and difficult, which leads to symptoms. The food enzyme contains enzymes like betaines for protein digestion, pexins, bromelains, and patanes. It also has alpha-amylases for carbohydrate digestion and lipases or bile salts for fat digestion. It can be quite beneficial to take this product with your meal, not just for aiding in digestion, but also because it's proven that certain enzymes get absorbed and may provide overall help to your body.